Bone marrow disorders and iron recycling and loss. Now we are reaching to the end part of the iron metabolism and we are left with these two topics. Disorders in which bone marrow cannot use iron, hypoplastic anemia, a very rare disorder in which bone marrow does not make enough red blood cells. It is usually seen in the first year of life in B12 or folic acid deficiency. I'm not going into the detail into folic acid or B12 because when I'll cover these topics, then you'll come to know what is the role of B12 and folic acid in the formation of hemoglobin or in the formation of the RBCs. Pyridoxine related anemia, you have seen the role of pyridoxine in the heme synthesis, so it plays a very important role. And if pyridoxine is deficient, vitamin B6 is deficient, obviously the formation of heme will be compromised. Hemolytic anemia, the plasma concentration will be high due to hemolysis. Iron released from destroyed uh, erythrocyte raises the level of iron in plasma, bone marrow stores, and ferritin concentration is also high. So the plasma iron concentration will be high due to hemolysis. RBCs are broken down, hemoglobin is broken down, and heme is released, and heme it then releases iron. So the iron level will be increased in the plasma. Bone marrow stores of iron will also be increased, and ferritin concentration is usually high because it is containing iron. Acute liver disease. Disruption of the hepatocyte releases ferritin. What are ferritin? Iron stores into blood and causes a transient rise in the plasma iron concentration. So when the hepatocyte liver cells are damaged, ferritin is released and the iron concentration will be high. Same is the case with cirrhosis. Cirrhosis, hepatic cells are damaged and therefore there will be a iron release in plasma probably due to the increased iron absorption and intake. Other pathological factors affecting plasma iron concentration, any chronic illness or acute illness, even a bad cold, decreases the plasma iron concentration because the dietary intake is compromised. Same happens in the malignancies, in the renal disease, in the arthritis. The dietary intake is compromised, and all these conditions, the iron concentration will be low. Iron recycling and loss. Most of the iron in the body is recycled by the reticuloendothelial system, which break down the old red blood cells. The average amount of iron loss for healthy people are estimated 1 milligram a day for men and 1.5 to 2 milligram a day for women with regular menstrual period. If there is a heavy menstrual cycle, obviously the hemoglobin loss or the blood loss will be more, and in this way the women they become deficient of iron. There is no physiological regulatory mechanism for excreting the iron. Certain physiological and pathological conditions can lead to iron loss, but there is no some hormone or some any enzyme which can excrete the iron in the urine or in the feces. So there is no physiological regulatory mechanism. Shedding of the mucosal lining of the gastrointestinal cells, they lead to the iron loss because the absorption of the iron will not take place. Sweating, iron loss was directly related to the volume of the sweat lost, and the amount is 22 to 22.5 microgram of iron per liter of sweat lost. By the shedding of the skin cells, all skin cells they contain iron. People with GIT diseases, parasitic infections, they often use more iron. The total daily loss is about 1 milligram, urinary loss, which is negligible. Feces contain unabsorbed iron as trapped in the intestinal cells, and any other condition which is leading to blood loss can produce a deficiency in iron, or the iron loss is there. Iron deficiency. Functional or actual iron deficiency can result from the variety of causes, and these causes they can be grouped into several categories. So the deficiency of the most common cause, the deficiency can occur when there is an increased demand for iron, which the diet cannot accommodate, or the diet is not providing the sufficient amount of iron, or there is an increased urinary, or there is an increased loss of iron, and usually it takes place through the blood. Nutritional deficiency. This can result due to the lack of dietary iron or consumption of food that inhibit iron absorption, such as tannins from tea. So tea, the tannins present in tea, they inhibit the iron absorption. Absorption inhibition has also observed in diet containing phytates and bran, calcium from supplements or dairy products. It is a very interesting thing that the calcium from supplements or dairy products, they inhibit the absorption of iron. This effect on calcium absorption may be of short duration, but don't stop the calcium intake, don't stop the milk intake. It is for a short duration, and once the adaptation occurs, then the iron absorption it becomes long. This may explain why studies on long-term calcium supplementation of different groups fails to show any adverse effects on the iron status. Why? Long-term supplementation does not badly affects or do not show any significant adverse effect on the iron status, because the absorption, the inhibition of its absorption for its short duration, and number two, the very important thing, the body adapt to the change in the environment, to the change in the dietary constituent, and therefore the inhibition does not occur. Acid reducing medicines. The medicines which are used for the inhibition of acidity, they reduces the absorption of dietary iron. And these medications are usually used for gastritis, reflux diseases. Reflux diseases, that is when you feel burning or acidity in your body, and for the ulcers. Proton pump inhibitors, antihistamine, antacid, antihistamines which are used for the allergic conditions will reduce the iron metabolism. Damage to the intestinal lining. You have just seen that all the absorption and it takes place through the intestinal lining, the enterocyte, they contain ferroportin, it contains ceruloplasmin, and in this way the iron is absorbed as well the iron is transported. As well as a divalent metal transporter is also present in the intestinal membrane. So whenever there is a damage of the intestine involving duodenum or diseases like corn disease or celiac disease, then it reduces the surface area available for the iron absorption. Crohn's disease is a type of inflammatory bowel disease. Celiac disease is a chronic disorders of the digestive tract. और लोग जो हैं ये कोई भी wheat की प्रोडक्ट जैसे आम रोटी नहीं खा सकते हैं. They usually use जौ की रोटी or barley or some other thing for the substitute of wheat protein. So the patient of celiac disease, they cannot tolerate the wheat. They cannot tolerate the wheat protein gliadin, and therefore they have to choose an alternate source of uh, flow. So in this way, we have completed the iron metabolism. Now we'll start the plasma proteins. That what types of the plasma proteins are present in your body and what are the functions of different types of the plasma proteins.